Lawmakers are demanding changes to the statute of limitations in Ohio after a federal judge dismissed Dr. Richard Strauss abuse civil cases. Hear from the chair of the Ohio Democratic Women's Legislative Caucus, who says this is personal. Protesters at the State House speaking out against that so-called trigger abortion ban bill. We'll explain how it would work if passed. And lawmakers push to make it easier to opt out of a COVID-19 vaccine mandate. But the bill didn't make it very far. Thank you so much for joining us for Face the State. I'm Tracy Townsend. We're going to start with that legislative response to the dismissal of the lawsuits over the abuse by the late OSU team Dr. Richard Strauss. The judge dismissed the civil cases against the university late last month, citing the statute of limitations. In fact, the judge said the legal system failed the victims. Well, now lawmakers are trying to change it so this does not happen again. For at least one member of the Ohio legislature, this is something of a personal matter. State Representative Lisa Sobecki represents Ohio's 45th Ohio House District. She is also the chair of the Women's Legislative Democratic Caucus and a rape survivor.
I just want your viewers to know, I have a wealth of information around this because I'm actually a rape survivor myself. So understanding full-heartedly what these, at that time, young athletes were going through at their time at OSU. And then so many years later, I'm hearing a judge say, basically, had we not had limitations, this would have been a different outcome. And my office has heard from many of these survivors. I've worked very closely with them and have heard their stories. And quite pointedly, had we had hearings on these bills, we may be in a little bit different situation in the state of Ohio. Science evolves, and when those cases are worked through, statute of limitations could have passed by the time that the technology is caught up with these survivors. So, I kind of have a mindset that justice should not have a limitation, and for these young men, and rape and incest is not just women, it's also men. And we saw over 177 Ohioans that went to the Ohio State University come forward and tell their story, and to be told now that, because there was not a law in place on the statute of limitations, that they can't get relief on what happened to them so many years ago, when so many of them came forward and reported it and did everything that they were told to do. And so every time for the years it's gone through this, the survivors that I've talked to, they have relived this every single day of their lives. And to not have justice for them, it just breaks my heart. And the state of Ohio, I value Ohioans, and we should be valuing Ohioans. And these are bills that I believe that should have hearings and get a vote, bring it to the floor, and protect those Ohio survivors.
Chants heard throughout the State House this week as lawmakers take up a so-called trigger ban on abortion. Members of the Senate Health Committee heard arguments from people in support of SB 123, known as the Human Life Protection Act. The bill would ban abortions in Ohio in the event of a U.S. Supreme Court decision overturning the 1973 Roe v. Wade decision. SB 123 makes no exceptions for abortions, even if a woman is raped or if a woman is a victim of incest.
We believe that women who have been raped and who have undergone something so terribly, terribly violent. We believe that perpetuating that violence against her innocent child, who is another victim in the scenario, doesn't undo the trauma. It doesn't undo the hurt. It only adds another victim to the scenario.
It's terrible for all people who are trying to make very personal healthcare decisions about, the future of their lives and their families.
Supporters say 12 other states have passed this particular Human Life Protection Act legislation. No action was taken on the bill this week, but we are going to monitor this. We'll keep you posted if and when lawmakers take action and vote on that bill. A Republican House bill to expand vaccine exemptions for Ohioans also getting a lot of attention. This week, the bill passed through the Health Committee with an 11-3 vote right there along party lines. 10 TV's Olivia Eugenio was there and has more now on what House Bill 435 would mean for you.
The Ohio COVID-19 Vaccine Fairness Act was unveiled Tuesday.
This legislation is sensible and responsible.
The Republican bill outlines exemptions to the COVID-19 vaccine if passed. Here are the exemptions they're proposing for most employees of both public and private businesses. Medical reasons: if a person has natural immunity, meaning they've had COVID before and have antibodies, and reasons of conscience, which includes religion. Students of both public and private schools would also be allowed the same exemptions, but anyone working in a children's hospital or ICU that includes students who study there are not included in the bill.
We want to be cognizant of protecting those that are in the most compromised of states.
Employers would, however, be allowed to require other measures for those who do not want to get vaccinated, such as weekly testing or masking. Upper Arlington Democrat Allison Russo was against the bill passing committee Tuesday. She says it's rushed. Representatives had just minutes to read the bill before the committee meeting Tuesday. The committee also didn't hear from anyone in the community.
There are a number of issues that have been added into this legislation that this committee has not discussed before that are deeply concerning.
The sponsors of the bill said this bill needs to be pushed because of approaching and future vaccine mandates.
The sense of urgency is there because these deadlines are looming.
If this bill passes, it would be in effect until June 30th of 2023. At the State House, Olivia Eugenio, 10 TV News.
Proof of vaccination status is now required at more venues across the city. If you are not carrying your vaccine card or negative test result, you may not be able to enjoy a concert or attend an event. 10 TV's Clay Gordon has a look at an option that could be a more convenient way to prove your status.
It's kind of becoming second nature. Just as you would show your ID to drink at a show, now you just have to kind of show another thing to get into the venues.
Marissa McClellan of Promo West Productions, that operates Express Live, A&R Music Bar, The Basement, and the Newport Music Hall, says vaccine requirements were the ticket back to live music in Columbus.
I think a lot of people understand that in order to see live music and the music that they've missed for this last year and a half, this is the step that needed to be taken.
McClellan says there have only been an occasional issue at the door with the new rule in place.
Initially, when we first started the requirements, it was a little bit of a bumpier road, but now that we've had, almost 2.5 months or so under our belts full of shows, people pretty much know the deal now.
So what if you don't have your vaccination card with you? Well, this venue also accepts verified apps and websites. But we spoke with one company that makes these bracelets where you could scan it to prove your vaccination status.
It's just like a menu. You put your phone on it or somebody else's phone on it or an iPad or whatever, focus on the QR code, and that takes you right to the landing page.
Dr. Tashoff Burden is a practicing physician. He and his son came up with the idea for Immuniband.
And it's used by a lot of people for restaurants, for sports venues, for any places.
He says the metal-plated and silicone bracelet could prevent you from losing your paper card.
The process of getting a duplicate, it varies very much from state to state and even from site to site. And it can be long and involved. Also, they don't really fit well in the wallet.
Dr. Burden says they are rejecting about 10% of uploads, some for technical reasons like a bad photograph. The company plans on expanding to a subscription model to include updated requirements during the pandemic.
Over time, we want to look at other vaccinations, but right now we're just looking at COVID vaccination, booster shots, and PCR testing.
And that was Clay Gordon reporting. Dr. Burton says all of your sensitive information is stored on secure servers and can only be accessed with a PIN code to prevent someone from scanning your QR code without you knowing. President Biden got a vaccine boost this past week right there on national television. This is the commander-in-chief's third dose of Pfizer's COVID-19 vaccine. Biden also made a plea for more Americans to get vaccinated.
A quarter of the country can't go unvaccinated, and that's not continue to have a problem.
You may remember the CDC recently endorsed boosters for seniors, medically vulnerable adults, and people with high-risk jobs, like healthcare workers. A local doctor was part of the CDC Advisory Panel that voted 9-6 against giving booster shots to adults at a higher risk of exposure to the virus because of their workplace or institutional setting. Dr. Pablo Sanchez works at Nationwide Children's Hospital and is professor of pediatrics at the Ohio State University College of Medicine. He explained to us why he voted no.
Listen, if I'm going to approve this 18 and over for healthcare workers and other areas of high transmission, I'm like, we have COVID all over. So everybody is at high risk for transmission. I mean, and actually it's been shown that healthcare workers are more likely to get COVID outside the healthcare system than here, than in the hospital. We have abundant PPE. We know we screen patients. We have less transmission from patients, at least currently. I'm not talking about the beginning of the pandemic in the high risk areas, but currently, the transmission is really more out in the community. I think I'm more likely to get COVID if I were to go to certain areas, crowded areas.
California banned some people from traveling to Ohio for business. It's all because of a clause in the Ohio budget. Governor Mike DeWine responds to that ban. From California next. This week, the House Criminal Justice Committee took up the Reagan-Tokes Act. It's named after murdered Ohio State student Reagan Tokes. In 2017, she was kidnapped, raped, and killed by Brian Goldsby, a convicted sex offender who had recently been released from prison. The bill aims to shore up shortfalls with how ex-prisoners re-enter society and are monitored by parole officers once they leave.
The system is definitely broken. Reagan Tokes, Rachel Anderson, Tamika Turner, these are three young women, daughters, sisters, and a mother, whose lives were taken by violent felons being supervised by a broken adult parole authority system that is understaffed, under-resourced, and has misplaced priorities. House Bill 166 will not bring back these women or the countless victims that those on parole in our community have felt the pain of these types of crimes, but it does make considerable steps towards addressing some of the circumstances behind these violent crimes.
This is a reintroduction of the bill. It's co-sponsored by Representative Kristen Boggs from District 18 and Representative Rick Carfagna from District 68. No actions were taken on that piece of legislation this week, but we'll be sure to track its progress. Now, the state of California is adding Ohio to a list of banned states for state-funded travel. It's because of a clause in our state budget. The clause allows medical professionals to refuse treatment if doing so would violate their personal, moral, or religious beliefs. Critics believe the clause could create situations where LGBTQ plus Ohioans are treated unfairly. California now has travel restrictions for 18 states over laws the governor of California believes are discriminatory.
They're talking about their state employees not being able to come to Ohio. I'm wondering how. Probably doesn't happen too often anyway. I'm not concerned about that. California, they have a right to do what they want to do. But our intent was certainly had no intention to discriminate against anyone.
A third lawsuit is now filed against Ohio's newly drawn legislative district maps. It was filed this week in the Ohio Supreme Court by advocacy groups. The latest complaint challenges maps of the Ohio House and Senate districts. The Ohio Redistricting Commission passed the new lines earlier this month. We've reported that to you. This suit follows two others, but some Republicans defend the maps as fair and constitutionally compliant. If you live in the Columbus area, you might have a new state rep. Latina Humphrey was appointed to lead Ohio's 26th House District. You might recall former Representative Erica Crawley stepped down to begin her role as Franklin County Commissioner. So you have a new person in the 26th district. Is Ohio running behind when it comes to getting the economy back up and running? One economist we talk with says yes. He'll explain why after the break. A $3.5 trillion reconciliation package took center stage in Washington, D.C. this week. It's aimed at expanding the nation's social safety net and fighting climate change. It includes 2 years of free college tuition, child care assistance, and more paid maternity and family leave. To pay for all of that, the Democrats are proposing raising the corporate tax rate. On the Senate floor, U.S. Senator Rob Portman pushed back against that plan. He says it would hurt small businesses.
I know none of my Republican colleagues are going to support these tax hikes because they believe they would be devastating to small businesses and to our economy at large. And I would urge any of my colleagues on both sides of the aisle who care about our long-term economic health to take a long look at what this tax plan would actually do, what it would mean to our competitiveness, what it would mean to individuals and families, what it would mean to small businesses, and instead make the smart choice to reject these tax increases on the small businesses, the very small businesses that drive the economy in the United States of America.
Democrats, including Senator Bernie Sanders, argue the bill will help ordinary Americans who are struggling to make ends meet. Ohio's minimum wage is about to increase starting January 1st. It's going up to $9.30 an hour for non-tipped employees, and it's going to be $4.65 per hour for those who are tipped. The changes come from a constitutional amendment that was passed by Ohio voters back in 2006. It states Ohio's minimum wage should increase each year based on the rate of inflation. Remember, the latest consumer index report shows there is a 5.8% inflation increase since last September. So those increases there. Researchers say when it comes to creating jobs, Ohio is currently running behind the rest of the United States. 10 TV's Kevin Landers talked with Michael Shields with Policy Matters Ohio to find out why.
Ohio has recovered more than 620,000 jobs since April of 2020. That was our lowest month from the COVID recession. But as of August, we're still missing about 264,000 jobs since before COVID-19. That's 4.7%. The U.S. is down about 2.7%. So the U.S. is recovering jobs about 3 times as fast as Ohio.
Is this a function of Governor DeWine's policies, or is it something else?
You know, this is a problem. It took Ohio over 7 years to fully recover the jobs that we lost to the Great Recession. That recovery was dragged down by austerity policies that cut government spending just when it was needed the most. Federal policymakers, I think, learned from the mistakes of that recession and passed historic fiscal stimulus this time. That includes lots of direct stimulus. It includes robust unemployment compensation that recovered a lot of folks who are usually excluded from state benefits because they're paid too little or because they're paid workers, if they're classified or even misclassified as contractors, not employees. Ohio policymakers, I think, have mishandled a lot of the opportunity that those payments have created to drive a really robust and equitable recovery. Governor DeWine blocked Ohioans whose jobs were destroyed by COVID-19 from receiving $300 a week federal payments. That choice has caused a crisis for a lot of Ohio families. It's also cost Ohio $1 billion in federal funding that families didn't have to go out and spend at Ohio businesses. And Ohio has spent $1.5 billion in American Rescue Plan dollars that were supposed to be used to drive recovery to instead pay off debt borrowed by Ohio's Unemployment Trust Fund. The fact is, we needed to properly fund Ohio's unemployment system long before COVID-19. Employers pay an unemployment tax on only the first $9,000 in wages. But instead of fixing that, Ohio lawmakers have bailed out our underfunded system with money that should have gone to the people hit hardest by the COVID recession, to frontline workers who have kept us safe through this crisis, and to drive recovery to drive a robust recovery that really includes everybody. We are gaining jobs. We have gained back a little more than 620,000 jobs since our lowest month, which was in April of 2020. In the first few months after the stay-at-home order that Governor DeWine issued, our jobs recovered pretty rapidly. But for the last several months, our job recovery has been pretty slow. It's been recovering at 6 months. Over the last 6 months, it's been averaging about 0.14% per month. So at that rate, it's going to take us right around 43 months to recover all the jobs that we've lost.
So how does that compare to other states? How badly are we doing compared to other states? Are we doing just about is every state basically doing the same thing, or are the states doing better than us?
So we're recovering more slowly than the nation. I haven't looked at other specific states, but if we look at the U.S. As a whole, U.S. jobs are recovering at a rate of about 0.45%. So a little more than 3 times as fast as Ohio over the last 6 months.
So what do you think needs to happen as we look down, if you look in your crystal ball and you've seen the numbers, what needs to change in order to jumpstart the economy for the next 6 months?
Sure. So I think one of the things that policymakers really have taken away from the last recession is that it's government's job to help to drive a recovery when we're coming out of a recession. This is something we've seen historic fiscal stimulus, both in direct payments and also through really robust unemployment compensation. Unfortunately, Ohio opted, Governor DeWine blocked $300 in enhanced federal benefits in June of this year to folks who've lost their jobs as a result of COVID-19. And this month, the first week of September, Congress allowed extended unemployment benefits and also benefits that went to folks who are excluded from state systems to expire. So those are things that I have real grave concerns will slow our recovery. In order to drive a robust recovery, we need to direct fiscal stimulus to the folks who need it the most, people who have been harmed by COVID-19, and also to recognize and adequately compensate the folks who have really carried us through this, who got us through the pandemic and are helping us as we recover.
Here's a look at the most recent unemployment numbers for the state. Last week, initial jobless claims dropped by more than 2,000 from the previous week to just over 10,000 people. You can see in this chart the numbers have been up and down this month, but last week's increase is below the 8-week average. Governor DeWine and First Lady Fran DeWine now have a new award to their name this week. The Ohio State University's president, Dr. Christina Johnson, presented them the award for outstanding contributions for trauma and resilience. This was part of the 2021 Faces of Resilience event, which raised $411,000 for mental health programs at Ohio State.
There's one advantage of having, how many political jobs have I had? 7, 8, I don't know. But when something like a pandemic comes along, there's always something you go back to in your experience. It's not that we've experienced in our lifetime a pandemic, but I think that experience helps. And I think back as we look at behavioral health and the challenge we face, I first started to really understand some of the causes when I was a young assistant county prosecuting attorney. And the first job I had was representing children's services down in the basement in the juvenile court. And that's where I saw that, so many kids had trauma. They were getting trauma at home or someplace else, but it was trauma. And, one of the things that, of course, we have learned is the number of incidents of kids get trauma, it impacts them. And there's a real science behind this and a predictability behind it. And so a lot of what we have tried to do since I've become governor is to understand that trauma and try to either eliminate the trauma, or if you cannot eliminate it, at least to try to deal with it. You look at what trauma causes a lot of different things, but certainly addiction in many cases, as well as challenges in regard to behavioral health.
Congratulations to them, and thank you for joining us today.